Every aspect of the work that we had done for HIV is directly relevant to the fight against COVID.
One of the province's top experts in HIV/AIDS is saying lessons from the past are helping present day. That message coming on World AIDS Day, which has been marked every December 1st since the height of the global AIDS epidemic. To this day, people continue to bring fresh flowers here to the Vancouver AIDS Memorial in memory of friends and loved ones. It stands just steps away from Sunset Beach. Engraved in the steel are the names of nearly 800 British Columbians who lost their lives to the disease. Dr. Julio Montaner has been a cornerstone in the fight against HIV/AIDS since the 1980s. He says we've learned a lot in the last 40 years and shared his advice as we fight the latest health crisis facing the globe, COVID-19.
These are difficult issues, and education is the answer. Whether it is from early identification of cases through seeking individuals at risk and offering them testing to management of those individuals in the most appropriate fashion.
And he says he's seeing firsthand how old lessons are being paired with new techniques in the fight against COVID.
There is genetic monitoring of the epidemic or other strategic interventions to be able to move the needle forward.
The Dr. Peter Centre in Vancouver held a virtual tour to mark World AIDS Day. The centre is not far from St. Paul's Hospital and is named for Dr. Peter Joseph Young. He was a young gay Vancouver doctor who received an AIDS diagnosis over 30 years ago. He wrote a series of diaries telling his story with the intention of providing hope, but also provide a reality of what it was like living with AIDS at that time.
If we think about those times, AIDS patients were denied medical care. AIDS patients were denied access to hospitals. Families disowned people. People were shunned. The stigma, the fear, rather than having compassion and trying to support and work with these people, we ignored them, we expelled them out of our lives. And so that was, AIDS then.
He says he's relieved to see the lessons we've learned from our experience with HIV/AIDS are being heeded as we face this latest pandemic.
We emptied out the hospitals. We made sure that we had space. So if people were going to get ill, we would have space to take care of them.
In Vancouver, David Zura, City News.